Welcome back. We're back with Dr. Jason Day and Dr. Makenzie Schouten to shed some light on sensory challenges and anxiety. And I think we've all experienced that the past year or so. Do you mind, can I ask you about this past year and COVID and whether your practice saw more of stress and anxiety-ridden patients than in the past and how you're coping with that?
Yeah, I think if we take a look at the objective facts, I mean, there's a lot of opinions about last year, but the fact is, it wasn't good for anybody.
No.
Businesses, were tanking, marriages were struggling, chemical dependencies through the roof, opioid overdoses, but also the sensory community that we work so with. And you'll find somebody no more loving, no more supporting of children with autism and sensory challenges. We're not here to treat these kids. We're not here to fix this. We're here to help them adapt better to the challenges of life. But I think we all had a bit of anxiety, just not know what's coming up. But it's been tough, and again, I don't want to get too political or too controversial, but I've seen the post on a lot of the community pages where parents are desperately reaching out because an 8-year-old does not need to be sitting in front of a computer all day, especially an 8-year-old with sensory challenges. And this mom posted a picture of her child just bawling his eyes out, reaching out for connection. This is a few months ago when it was even more volatile, just asking for help, asking for connection. And the comments were about 50-50, 50% like, yes, we can help, let's meet at a park, let's do it safely. And the other half was just like, deal with it, like as if we need to marginalize this community even further. And all these health statistics, I saw out of San Francisco, there was a 66% increase in suicides in teenagers and children. We're not even talking about adults. 70% increase in hospitalizations due to anxiety and panic attacks. And I would imagine these numbers are all across our country. And again, it breaks my heart, but I also know that we have some resources. And we've seen this uptick. And yeah, it might be good for business, but that's not my purpose in life. Our purpose is to make a difference in people's health. And if we can do that by talking, but also giving them options and care plans to get better and stay better, because we can't control what goes on in Washington. We can't control what goes on in Raleigh. Can't even control opinions on your cul-de-sac. No. But we can control what goes on in our health and our children's health, and how do we empower ourselves from the inside. But yeah, there's been a huge upswing in stress and anxiety.
And let me ask you, because I know my little one is almost too young to really understand the COVID, but she certainly is well able to understand I'm sitting in front of a computer. I don't have that social interaction. What are you seeing with the patients you're seeing? For the kids, I mean, in coping with something that I'm not even sure how a parent would bring that child to you. I mean, because it's oftentimes they don't say anything. So what are you seeing and how are you dealing with that?
You see all sorts of spectrum of things, especially with the not being able to interact with their peers and stuff. You just see a lot more anxiety, a lot more focus issues. Kids are not designed to be sitting at a computer all day for 8 hours a day. That's just not what is meant for them. And so a lot more of everything that they struggled with before is just a lot more difficult now.
So when you have these, I'll call them adjustments or whatever, do you see, how quickly do you see improvement?
Sometimes within moments.
Really?
And again, I always like to get down to the level of a child, and I'm pretty childish. My wife would advocate for that fact. But no, my thing is like I want them to connect with this experience, even if they don't fully understand it.
Right.
So if you come in our office, like I said, you'll see kids jumping on a table because we respect them. We respect their space. So often when we're adjusting babies or little kids or even some little bigger kids, mom's laying on the table and holding them with a hug, not holding them down. We never have to force anything. And especially in the sensory community, you don't want to force anything with these kids. You want to love and respect their space and just encourage them on this health journey. And more often than not, it might take a few visits, but the purpose of that adjustment is to remove that neurological stress. And again, I could give you a highlight reel of where it happened in 1 or 2 adjustments, but a lot of times healing takes time.
Sure.
These care plans can be months long. And again, not that that's long if we've had a child or an adult that's been struggling for years. To me, it's a miracle things can turn around in a few months, but all those care plans are laid out up front. We don't do contracts, we don't have to trick people to stay there, but we do give them care plans based on the thousands of people we've helped with similar challenges, but also based on that unique blueprint that we gather on day 1 with those scans.
Well, tell me a little bit about this sensory workshop. What is that?
So yeah, like these news segments or 5-minute conversation on the phone, you can't unpack the complex world of sensory challenges, autism, in 5 minutes.
No.
So we dove deeper, and even an hour-long workshop is just enough to lay out the science, the facts, the research. Like I said earlier, there's a time and place for opinion. It's not at that workshop. We don't get on soapboxes. We don't talk about one thing that causes autism, because there's not one thing. There's a myriad of stressors. So we dive deep into the science and neurology behind what is fight or flight spectrum of spectrum challenges, but also how do we get out of that? How do we adapt better? Even though we have this diagnosis, how do we help with the tantrums, the meltdowns, the digestive challenges, the immune system? And like I said earlier, we're not treating any one of these symptoms. We're addressing the neurological cause. And when we do that, amazing, borderline miraculous things can happen. And the miracle is not this, it's not me, it's not her, it's in every child, it's in every adult. That's what we want to unpack in that workshop. And thankfully, we're able to get back together safely. We space it out. We even do webinar options too. But we want to empower parents. That's the mission of our practice in our life, is to empower parents with better information so they can make better decisions. We're here to partner with other professionals too. We're not a one-stop shop. We don't do everything. But if we can lay that foundation, so many of these puzzle pieces that just haven't been coming together for these families is going to start making sense and start making results.
Well, this is a much different perspective. It really is that I've ever had of what you guys do. For the folks who are viewing this morning, what's the best way they can get a hold of you and maybe come in and see you and get some of these things fixed?
Yeah, do your research. Yeah, and you can find us pretty easily, but you can find us at our website, chiropractorhollysprings.com. We do have a pretty large footprint in social media, so you can find us at Trinity Life Center on Facebook or on Instagram as well. And it's us sharing stories, sharing testimonies, sharing science, and sharing that unique perspective that just some people just didn't know. And it's our job, it's our responsibility to get that message out. Like, I take full responsibility that you didn't know these things. It's our job and it's our passion to give that message. So yeah, we do have the workshop. We're back to that monthly cycle, but we're putting out stuff daily because we want to give that hope, but most importantly, the help and the resources these families need.
Well, I think it's awesome what you guys do. And the fact that now, for folks who may not have thought they had options, they have options.
Yeah.
So I hope they get a hold of you. Thank you, guys.
Thank you so much for having us. Yeah.
Thank you.
And thank you for watching today. We hope you enjoyed today's show. And if you have any questions or would like to know more, visit our websites at RaleighCW.com and myrdctv.com. I'm Bill LeMay, and thank you for watching Community Matters, and we'll see you next week.